Well, even after recovering from COVID-19, people of all ages are seeing lingering side effects that require rehabilitation. Joining us to talk about this now is Cassidy Marang, physical therapist with Hartford Healthcare's Rehabilitation. Welcome, Cassidy.
Thank you.
So what types of treatment can Hartford Healthcare Rehabilitation Network provide to those recovering from COVID?
So recovery really happens across a continuum, starting at the ICU level of care, working them through the medical floors, transitioning them to home, and then finally into the outpatient clinics, and then finally on their own. We can provide speech therapy, occupational therapy, physical therapy to address any cognitive impairments, self-care, activities of daily living impairments, and then just their physical ability to navigate their environment.
Wow, pretty comprehensive. And tell us what your experience has been treating patients with COVID.
So in March, I was pulled to work full-time in the hospital. And so I worked in the emergency department, the ICU, up through the different levels of the hospital. So on those COVID units, working very closely with the nursing teams and watching some pretty amazing things happen. In August, I got put back to my original role, so I'm split between the inpatient and outpatient setting. So now I'm able to see patients who were sick with COVID and in the hospital in the spring, and now are coming. They've worked their way through, and I'm treating them in the outpatient clinic and really working on those final goals and getting their lives back.
Good for you. You're a healthcare hero. So many. All right. Tell us more about how the Rehabilitation Network helps patients transition through the healthcare system from that acute care to outpatient to home care.
Sure. So as rehab providers in the hospital, we do play a strong role, and we work closely with the case coordinators and the physicians. And once we evaluate the patients, we kind of help provide recommendations for any equipment they may need as they're transitioning out, and also provide recommendations for where we feel they will be most successful, whether that's going home with family, or going to short-term rehab at a nursing home, or even to an inpatient rehab facility. So we kind of make those recommendations. We reassess day by day based on the progress that they're making, and then help facilitate that change. And then once they're home, we get our home care teams in there, and they work with them. And when they have maxed out and they're able to re-enter the world, they help transition them to the outpatient teams.
That's awesome. All right, real quick last question. What's your advice for someone recovering who may be unsure about their road to recovery?
Sure. Be patient. It can be a long road full of different obstacles you may not have expected just with a respiratory illness. And take a moment to celebrate every win, every little success that you get, because even the small ones, they bring you so far. So be patient.
Awesome advice. Cassidy Marang, thank you so much for joining us. Keep up the good work.
Thank you.
Thank you.